Good afternoon, everyone. My name is Dee Baker, and I have the privilege of working for hospice and community care. Thank you for joining us today for Hospice and Community Care's Financial and Estate Planning Seminar, Medicare 101, Gaining a Better Understanding of Medicare and Supplemental Plans and How They Work to Help You Choose What Best Fits Your Individual Needs. A few housekeeping items. Everyone except for the speaker will be muted during the presentation. If you have questions, please use the chat button at the bottom of your screen, type in your questions, and then they will address all of those questions at the end of the presentation. I'd like to introduce our speaker, Julie Martin from Teaman-Martin Associates in Lancaster. They specialize and focus on Medicare products. Julie earned her marketing degree from Northern Illinois University and joined the organization in 1994. She took over sole ownership of Teaman-Martin in 2019. She's active in the Central Pennsylvania Association of Health Underwriters and is a past secretary and president of that organization. She currently holds a license for life and health insurance. Julie, welcome, and I will turn the program over to you.
Unmute your mic.
There we go. There we go. Hello, everybody. My name is Julie Martin, and our main focus here at my Teaman-Martin Associates is Medicare, and that is why I'm often asked to do Medicare seminars. So today, like she said, we're going to go over what I call Medicare 101. I like to go over the Medicare 101 to make sure that you understand all the parts of Medicare so that you then hopefully at some point when it's, you're eligible for Medicare, that you can determine what products might be best for you. So you see the first sheet that is up on your screen. That sheet is what I call Julie approved, not Medicare approved. So for many years, I would sit down with people to go through Medicare and got a lot of blank stares. So I felt like developing this at least shows you the moving parts of Medicare and why I do kind of like to use this chart. Everything else, the other charts that you'll see in the presentation today are Medicare approved, and they are either off of the Medicare.gov website or the Medicare Imb guide that comes out every year. They update that every year, and that does get mailed out, or you can actually go onto the Medicare.gov site and get it electronically. So the Medicare 101 will get started. So you can see Medicare Part A on that chart. So Medicare Part A, if you have worked 10 years or 40 quarters, you qualify for Medicare Part A and you do not have to pay for Part A. Essentially, all the years that you've paid in your Medicare taxes does pay for your Medicare Part A. Medicare Part A is more the facility side of Medicare. So it is going to cover any hospital stays that you would have. It would cover your skilled nursing. It will cover hospice care. Sometimes home health care also gets billed under the Medicare Part A. So if you were to have a hospital stay in Medicare and you only had Medicare and no other products, the hospital stay would have a deductible. This year, the deductible is $1,484. The main thing to know about that deductible is that deductible actually applies each time you have a hospital stay. So if you had to stay the beginning, the middle, and the end of the year, each time you had that hospital stay, you would be charged the $1,484. So that's kind of your main exposure for a hospital stay. Skilled nursing, like I said, is also covered under Part A. The biggest thing to know about skilled nursing is that you must first have a 3-day hospital stay. So in order to get your skilled nursing covered, 3-day hospital stay, if you indeed have that stay and they approve you going into skilled nursing, Medicare will only cover 100 days in that skilled nursing facility. There is cost sharing for that also. I believe the cost sharing now is they'll cover your first 20 days in the skilled nursing, and then I believe it's $184.50 each day, 21 through 100. But like I said, the main thing to know is day 101 and beyond, you are paying the full cost for skilled nursing. And then Medicare does pick up the hospice care. So those are your main components and main thing to know about Part A. It is more facility driven. Then Medicare Part B. Okay, Medicare Part B, there is a premium to Medicare Part B. And Medicare Part B, that premium is based on your income. So most people right now are asked to pay $148.50 each month for Medicare Part B. If you are taking Social Security, that $148.50 is going to come automatically off of your Social Security. If you are not taking Social Security, they will bill you quarterly for that amount. So just because you have Medicare does not mean you have to take Social Security. And just because you have Social Security doesn't mean you also need to enroll in Medicare. So like I said, the $148.50 is what most people are asked to pay. We don't need to switch pages, but just so you know, in your packet, you can see there's two other pages behind this top page that have the premiums that you would be asked to pay based on your income. So if your income is higher, depending if you file single or file joint for your taxes, you could potentially, based on your income, be asked to pay more for this Medicare Part B. Keep in mind, if you're also asked to pay more for your Medicare Part B, they're also going to charge you based on your income additional for Part D, which is prescription. Okay, so if you pay more for Part B, you're also going to pay more for Part D. If you're asked to pay the $148.50, then that's what you'll pay for Part B, and there will not be an additional charge for Medicare Part D. So Medicare Part B is the medical services side of Medicare. So the medical services side has anything to do with doctors. Anytime you see a doctor, anytime he orders anything. So that would be any like lab work, testing, physical therapy. Durable medical equipment also falls under Medicare Part B. So durable medical equipment would be like oxygen, wheelchairs, walkers. That falls under Medicare Part B. Also under Medicare Part B are what they call Medicare Part B drugs. So those would be drugs while you're actually in the hospital. Also, any infusion type prescriptions would fall under Medicare Part B. So that would be like chemotherapy. If you had to have infusion type, would fall under Medicare Part B. Again, if you only had Medicare and no other products, for Medicare Part B, there is a deductible. This deductible is called the Part B deductible. It's $203 this year. That $203 is a one-time per year deductible. After you've met that one-time per year deductible, then they're going to ask you to pay 20% of everything after that. Okay. So you meet the deductible of $203, you pay 20% of your services for the remainder of the year. That 20% in Medicare could be your largest out-of-pocket expense. So if you had a long extended hospital stay where you have doctors coming in and out, and they're ordering all kinds of lab work and testing, you would be responsible for 20% of whatever that bill ends up being. And Medicare doesn't have a maximum amount of pocket. So most employer plans that you would be on now are going to have a maximum amount of pocket. The maximum amount of pocket most times is like $5,000 or $7,000. Like I said, in Medicare, there is no maximum amount of pocket. So that 20% could end up being a very large out-of-pocket expense for you. I do believe that's a good, indicator of why somebody put products together for Medicare, because of that 20%. And then obviously the prescription coverage, initially in Medicare, prescription coverage was not available, and they started the Part D prescription plans in 2006. So they are also now trying to work to cover all the prescription also. So Medicare A and B, we talked about. How do you get Medicare A and B? Really, there's two ways, okay? One is when you age in, or when you actually turn 65, you become eligible for Medicare A and B. The second way is if you become Social Security disabled prior to age 65, you would also be eligible for Medicare A and B. Most times there's like what they call a 7-month window. You can apply for Medicare 3 months prior to the date, your date of birth, the month of your date of birth, and 3 months after is when you can actually enroll in Medicare A and B. If you are taking Social Security prior to age 65, they will automatically send you out and enroll you in Medicare A and B. If at that time you're working full time and you do not want to take Part B, even though you are enrolled in Social Security, you would have to decline Part B if you were going to stay on the employer coverage. How you enroll in Medicare A and B is actually done through Social Security. And then you can do it on the Social Security website. You used to be able to walk into Social Security. I don't think the actual walk into Social Security is available anymore. You can call into Social Security, I believe, and make a phone appointment and do it that way to sign up for Medicare A and B. And then if you continue to work full time, most times you don't want to pick up Medicare Part B and have employer coverage because you're usually duplicating what you have. So you would have to be paying your employer payroll deduction plus paying for Medicare Part B. So most times you would want to, what I would call, defer Medicare Part B. If you're not taking Social Security and you want to enroll in Medicare Part B, you have to be the one to initiate enrolling in Medicare Part B. The only way they automatically sign you up is if you're already taking Social Security prior to age 65. Otherwise, you have to be the one to initiate enrolling in Medicare Part B. And like I said, that's done through Social Security. You can do it, like I said, on their website. You can go in, or you can try to schedule a phone appointment. You can sign up for Medicare Part B usually 3 months prior to your whenever you want Part B effective, or 3 months prior to your birth date. But like I said, if you're already on Social Security, they'll do that. If not, you can enroll 3 months prior to your date of your birth. Medicare will make your Medicare Part B effective the first of the month of your birth month. So if you're the 15th or the 21st of October, they're going to make it October 1. So they'll always make it the first of the month, your effective date for Medicare. Okay. Medicare, oh, I know it. While we're going kind of through employer, what people really get worried about is having a penalty. So you get a lot of paperwork and they talk about penalties for not enrolling Medicare when you're eligible. If you decide to work full-time beyond age 65 on employer coverage, you do not have to enroll in Part B. And like I said, most times you don't want to enroll in Part B and still have employer coverage. You can remain on your employer coverage. That's considered creditable coverage. And there will be no penalty to you when you elect to go off of your employer coverage and then going to Medicare. So there's no penalty to you for staying on your employer plan beyond age 65. So when you decide to go ahead and retire, or you go part-time and your employer coverage no longer available, I usually say about 3 months prior to that, you would then want to go to Social Security and say, I want my Medicare to be effective, 3 months from now, so that you can start your Medicare going. But like I said, no penalty to you because you've had that creditable employer coverage. The other thing while we're kind of talking about employer coverage is at this time, COBRA is not considered creditable coverage. So if you decide to come off employer coverage and you think you're going to pick up COBRA, that is usually not a good idea. You could potentially pick it up for a month or two and not get into any penalties. But if you go beyond a month or two and have COBRA as your coverage, you could end up with penalties because COBRA is not considered creditable coverage. So make sure you understand that. Do you have, just nod, do you have a high deductible HSA plan? You do. Okay. If you have a high deductible health plan, you are not eligible to contribute to your HSA beyond the age of 65, nor is the employer. So you need to keep that in mind. You cannot contribute to the HSA beyond age 65, and nor can your employer. So you can still have a high deductible plan. You just cannot contribute to an HSA once you are Medicare eligible. So that comes up a lot. Just want to make sure I covered that. And I see there's some questions, so I will answer them when we get through kind of the rest of the presentation. Okay. Okay, so let's go on to how the products kind of fit with Medicare. So as you can see, I usually say there's really 3 directions that you can go with Medicare. One, you can just have Medicare. You don't actually have to pick up any other products. You can just have Medicare A and B. You don't have to do anything else. Most people do elect to pick up other products. So then I would say you kind of have 2 main directions if you elect to go with products. One is you elect to go what I would call the Medicare Supplement route, where you pick up a Medicare Supplement, and then most times you would also pick up or purchase a Medicare Part D prescription plan. So you can kind of see I have them all charted together. So you have to pay for your Medicare Part A and Part B, or your A you get, but Part B you pay for. You have Medicare. You would then elect to purchase a Medicare Supplement policy, and you would elect to purchase a Part D standalone prescription plan. That is one direction that you can go. The other direction would be what you see, the Part C Medicare Advantage plan. It kind of stands alone. When you elect to go with a Part C Medicare Advantage plan, most times that plan has the medical and prescription as part of one plan. You purchase one plan that has medical and prescription in the one plan. So initially, we're going to start off on the Medicare Supplement. I would go kind of down the Medicare Supplement route so that you can kind of understand that. When you elect to go or purchase a Medicare Supplement route, actually, if you printed out your packet, it is the very last page in the packet. So I don't know if we can forward to the very last page of the packet. It has, how do I compare my Medigap plans? Yeah. That right there. Perfect. So you can see these are Medicare Supplement plans or Medigap plan. If you hear that term Medicare Supplement or Medigap, they're talking about the exact same plan. These are federally standardized plans. So Medicare says to any insurance companies that want to offer the plans that they must offer these plans A through N, and they must be exactly the same. So for instance, if you had a plan G and you're walking down the street and everybody you pass walking down the street says they have a Medicare Supplement plan G, you know that everybody has exactly the same benefits. But those people that you're walking by could have different insurance companies. Different insurance companies can offer those exact same benefits of plan G, but at a different monthly premium for the same benefits. Okay. Medicare Supplements, like I said, federally standardized. There is no network of doctors when you have a Medicare or Medigap plan. All you need to know is if your doctor, hospital, facility, do they accept Medicare? So if they say they accept Medicare, you know that they're willing to bill Medicare, and then they're going to bill your supplement. So if you walk in a doctor's office when you have a Medicare supplement plan, you hand them their Medicare card first. They'll bill Medicare first. And then what Medicare doesn't cover, they're going to bill to your Medicare supplement plan. So you can see the plans A through N. Plans C and F have been the most competitive plans, because basically if you have a plan C or F, you have 100% coverage. So they bill Medicare, they bill your supplement, and you shouldn't see any additional bills. The difference between C and F, you can see, is in Plan C, there's a kind of no coverage there for the Part B excess charge, where the Plan F picks up that Part B excess charge. And what Part B excess charge means is if you were to go to a doctor in Pennsylvania and he charged you $120, Medicare is going to come back and say, well, we only allow, let's say, 68 of that $120. In Pennsylvania, our doctors, hospitals, facilities are not allowed to excess charge. So in Pennsylvania, you wouldn't see additional bills, but other states allow their doctors, hospitals, facilities to excess bill up to 15% above the Medicare allowable. So in this case, the $68, they can bill 15% above that if you're in another state other than Pennsylvania. So that Plan C, you'd have to pay it in another state, that 15% Part B excess charge. That Plan F picks that up, okay? However, the Plan C or F is no longer available to anybody aging in. So anybody turning 65 beyond January 1, 2020 is no longer eligible to purchase a Plan C or F. If you were 65 prior to January 1, 2020, you are still eligible to purchase Plan C or F. Okay. Plan D is going to mirror C. Plan G is going to mirror Plan F. But the Plan D and the Plan G do not cover the Part B deductible. So if you remember on that first chart we looked at, the Part B deductible this year is $203. So in that Plan G, your only responsibility for the year is the Part B deductible. So they'll bill Medicare first, they'll then bill your supplement. If you have not met that $203, you'll have to meet that. And then after that, you should not see any additional bills. Okay. The plans, I'd say Plan C through G. Plan G right now, if you're turning 65, is roughly about $125 a month for that plan. A Plan F would probably be more, a little bit closer to, at age 65, a little bit closer to about $140, I would say, a month. And every carrier's, like I said, going to be a little bit different, but just to kind of give you an idea. So you're going to pay for your Part B, that $148.50. If you purchased a Plan G, you may pay another $120, $125 a month for that Plan G. The plans K through N, in those plans, you can see there's percentages. So in those plans, if you were to have those plans, you're going to have to put more out of your pocket. You have more responsibility in those plans. And so you're going to have to put more out of your pocket as you have claims and services. Plan N has become a little more popular. In that Plan N, you would be responsible for any excess charges in other states. You would also be responsible for the Part B deductible, which right now is $203. And then it also has, you would pay up to $20 for any office visit and up to $50 for any emergency room visits. So roughly that plan for somebody age 65 is going to be about $100 a month. So same thing, you pay your Part B and then you'd pay that $100 for a Plan N. So you can see the Plan G, you're going to pay more premium, but you have less out of your pocket. The Plan N, you're having to share in a little bit more in the cost sharing for the services and claims. And so your monthly premium is going to be a little bit less. So that's your Medicare supplement. So you have Medicare, you have a Medicare supplement, and then you would need what they call, you would most likely want to purchase a Part D prescription plan. So a Part D standalone prescription plan. The lowest premium plan in Pennsylvania this year is $7.30. You could go on up probably to 200 and some dollars for a plan. But most people this year, it seems, can get a Part D standalone prescription plan for under $35 a month. So you pay the $148.50 for your Part B or more, depending on your income. You purchase your Medicare Supplement anywhere from $100 and $125. And then you have your Part D. So hopefully under $35 a month for your Part D standalone prescription plan. This is probably, the Part D prescription plan is probably the biggest difference most people see coming off of employer coverage. So if you could go to that second to last page in the program, it says 2021 Part D standard. It's the second to last. That right there, that chart. Go back one. Yep. Okay. So this chart, this is the Part D. This is federally standardized also. So Medicare says to any insurance carriers that want to offer the Part D prescription plan that they must offer this kind of standard plan or better. So this is kind of what I would call the minimum standard plan. And every Part D, whether you have it as standalone or you have it part of your Medicare Advantage, follows this chart that you're looking at. It has 4 stages to it. So you have your initial deductible. That initial deductible this year is $445. So you have to fill your prescriptions and fill up to $445. Once you've done that, you go into the next stage, which is the initial coverage period. That initial coverage period is kind of what I would call more like the copay phase and a little bit more similar to employer coverage. So in this initial coverage period, you'll see generics in the $0 to $15 range. You'll see preferred brands in a $30 to $40 copay range. Non-preferred brands will be $80 to $100 copay range. All the plans have what they call a specialty tier, which are real high-end injectionable type prescriptions. For those, they usually, your responsibility would be 25 to 33% when you fill those prescriptions. So roughly they say you pay about 25% of your prescriptions in this phase. So you are going to pay that $445 deductible. You get into the next phase, you pay your copays, and then you'll see, I don't know if your box is covering, it's covering mine, but at the end of that, you'll see $4,130. So that $4,130 in that second phase. So what you're paying plus what the insurance carrier's paying adds up. And when it totals for the year, what you've paid plus what they've contributed towards your prescriptions, $4,130, it then bumps you into the coverage gap or donut hole. So if you get into that coverage gap or donut hole, this is when you usually will pay the most for your prescriptions. They're going to ask you to pay 25% whether you fill a generic or a brand. It doesn't matter. You pay 25% of your prescriptions in this phase. So you go from that $4,130, you pay 25% of all your prescriptions until you get into the catastrophic amount. So when you then reach $6,550, you're then considered in catastrophic coverage, and then your cost sharing drops back. Your responsibility then becomes 5% of your prescriptions or low copays for generics. And then January, this starts all over again. Now, if you come in March, you're going to start at the initial deductible and go as far as you go until January. And then after that, you'll always be January to January. Now, like I said, this is the minimum standard. So that $445 deductible, some of the plans will apply that deductible no matter what you fill. Some of them will waive it altogether. Most of the Advantage plans, if you were to elect an Advantage plans, most of them will waive that deductible. But what we see a lot, especially in the standalone prescriptions plans, is they will waive that deductible as long as you're filling generics. But if you would then go to fill a brand throughout the year, they would apply that $445 deductible. Now, this, like I said, is kind of probably the most, the biggest difference you're going to see coming off of employer. So typically what we do is we look at your current prescriptions. You can go into Medicare.gov, which has a nice tool. You plug in all your current prescriptions, and then it'll run all the plans available in Pennsylvania, least out of your pocket to most out of your pocket. So you can pick a plan that way based on your particulars, what pharmacy you like to go to. But we usually do run a 3-plan comparison. The reason that we do that is some of the carriers have what I call hoops you have to jump through to fill your prescriptions. So those hoops would be if they have a quantity limit. So maybe you take 2 a day of something and they say, well, we'll only cover 1 a day of something. So you might want to know that up front. They also have prior authorizations on different prescriptions. So if you have a prior authorization on your prescription, your doctor would need to put in why it's medically necessary for you to take that prescription, and they make a determination if and how they'll cover it. The last thing we see is what they call step therapy. And that means you take prescription Z, they feel like X and Y does the same thing, maybe for less money. And then your doc may have to say they already tried those other prescriptions, still needs to take Z for these reasons, and they determine if and how they'll cover that. So this is kind of the Part D prescription plan. We talk about costs of that. So like I said, if you went the Medicare supplement route, like again, you pay the Part B, you pay your Medicare supplement premium, and you pay your Part D premium. So that's the one direction to go. With, like I said, Medicare supplements, there's no list of doctors, hospitals, facilities. There's not a lot of what I would call management in your care. So if your doctor orders an MRI, most times you go to the MRI facility, they probably on the back end, you didn't even realize they got authorization and you have your MRI. Not a lot of management in your care. Okay. So that's the Medicare supplement, what I would call the Medicare supplement route. Can you go back to the initial page, the front page with the circles? Thank you. So the Part C we'll go through now. So Part C is also called Medicare Advantage Plan. If you elect to go with a Medicare Advantage plan as your option, Medicare Advantage plans are more a networked type of plan. So probably similar to you have an employer, it might be a PPO, preferred provider organization, which basically means you have, most times if you stay on the list of doctors, hospitals, or facilities, or stay in network, you know what your copay levels are going to be. But you do have the option to go out of network or off the list of doctors. You just usually pay more to do that, but you have that option. They also offer HMO. So HMO basically means they have a list of doctors or in network only. If you elect to go out of network or off their list of doctors, you do not have any coverage at all. Okay. Medicare Advantage plans, probably my 4 top premiums for Medicare Advantage plans this year are a $0 premium, a $13 premium, a $35 premium, and a $70 premium. Those are probably my 4 top. There's plans also like $200, $300 you could pay also. But like I said, most of mine are in that 70 or under range. And yes, there are some $0 premium. When you elect to go with a Medicare Advantage plan, that plan that you elect to go with now pays instead of Medicare. So all of the billing is between the doctor, hospital, facility, and the Advantage plan that you elected to go with. Medicare is no longer in the billing at all. Because you are going to still have to pay for your Medicare Part B, let's say that $148.50. No matter what, you still have to pay that $148.50. But if you elect to go with the Advantage plan and Medicare is not paying your claims, what happens is Medicare sends the Advantage plan that you elect to go with a monthly per member amount. That helps them determine their copays, cost sharing, maximum out of pockets for the year based on the amount that Medicare sends them per member. So that's how there can be a $0 premium plan. Medicare Advantage plans, pretty much you pay every time you have any type of service. So a doctor visit may be anywhere from $5 to $15. A specialist might be a $30, $40 copay. Outpatient surgery such as cataracts, knee, shoulder, where you're in and out, might be a $200, $250 copay. Hospital stays, an inpatient stay is usually covered one of two ways, either per stay or per day. So the per stay carrier is going to say, I don't care if you're in 1 day, 5 days, 10 days for that stay, you're going to pay $400. Another carrier is going to say, well, we're going to charge you per day. So we're going to say it's $200 each day, 1 through 5. If you're in beyond the 5-day amount, they cap it at that. You wouldn't pay beyond that 5-day amount. If you were to need durable medical equipment, so that's the oxygen, wheelchairs, walkers, CPAP supplies, diabetic supplies, your responsibility on almost all the Advantage plans is 20%. Part B drugs, so drugs while you're in the hospital or any infusion type prescriptions are covered as Part B drugs. Your responsibility in the Advantage plan is 20% of those. So you can see pretty much everything you do in the Advantage plan has a copay or a cost share. All of those copays and cost shares add up. And when you reach a maximum out of pocket, then the insurance carrier picks up after that. The maximum out of pocket this year from most of the plans is $7,550. There are some plans with lower maximum out of pockets. The main way I see somebody getting to that maximum out of pocket in an Advantage plan is through those Part B drugs. So if you were to need chemotherapy and you're responsible for 20% of every treatment, you're going to hit a maximum amount of pocket pretty quickly by having any type of infusion, with your responsibility being 20% of those treatments. So that's the main way in an Advantage plan. Like I said before, the Advantage plans, that premium, let's say you chose a $35 premium, that $35 premium covers your medical and your Part D, your prescription, under one premium. That $35 covers your medical and prescription. That maximum amount of pocket is a medical maximum amount of pocket only. So your prescriptions do not go toward that. Like I said before, your Part D, that chart we went through, the prescription works pretty much the same whether you have a Part D standalone plan or you have your prescription as part of your Advantage plan. I'm often asked, what's the advantage of an Advantage plan? So one is lower premiums. You're going to pay lower premiums. The other thing is most of the stuff you hear on the TV. So they do have a lot of what I would call value added. So they often will cover like dental, some dental, vision, hearing. They will cover sometimes like a fitness membership, sometimes transportation to and from doctors, meals if you were to get out of the hospital. Those are some of the things that are often included in a Medicare Advantage plan. I do want to stress a little bit, when you are picking a Medicare Advantage plan, remember you're picking it for medical reasons. So I often get questions about the dental. The dental is a little bit tricky in Medicare Advantage plans. You have to really watch what dentists actually participate so that you could actually get any type of dental, any type of the benefit out of it. And it is a little bit tricky with the Advantage plans. There were some plans for a while that had like an allowance. You could go to any dentist and then be reimbursed. That was, that one's a little bit easier to use that way. So keep that in mind when you are picking them. Dental is a little bit tricky to get as part of your Medicare Advantage and really get something out of it. Kind of how I see the difference between these two plans. When you elect to go with a Medicare Supplement, you're paying more upfront in your premium, but you don't have a lot of risk or exposure on the back end. So if you had that Plan G that we looked at, your only risk every year is the Part B deductible, and then obviously whatever the premium is. Medicare Supplements, you will get a rate increase pretty much every year, but you don't have a lot of risk as far as claims on the back end. When you elect to go with a Medicare Advantage plan, you're going to pay less upfront in premium, but you could potentially take on more risk on the back end as you have claims and services. So up to that $7,000 this year, $7,550. They also change every year. So we'll see changes in the premiums, co-pays, cost sharing, maximum amount of pockets from year to year also. Okay. Now I want to go through kind of the last tricky thing, and then I see there's some questions that I'll go to answer. Is when you turn 65, if you elect to go on Medicare then, or if you elect to go on to Medicare after you retire, let's say you're age 70 and you decide then you're going to come off employer coverage and go on to Medicare. At that time, you will be guaranteed issue for any Medicare supplement that you want. So you can elect any plan, any carrier that you want. They can't ask you anything medically at all. At that same time, if you elect to go on a Medicare Advantage plan, same thing. There's no medical questions to go on a Medicare Advantage plan. Every year, there's what they call an annual enrollment. It runs October 15th through December 7th every year. During that October 15th through December 7th, at that time, if you have a standalone prescription plan, you can make a change then. No medical questions are asked at all to change your standalone Part D prescription plan. So you can make a change October 15th through December 7th. That change will take effect January 1. If you have a Medicare Advantage plan and you want to change your Medicare Advantage plan, there's no medical questions asked at all. Same thing, you can change it October 15th through December 7th. That change will take effect January 1. Medicare supplements do not fall in annual enrollment. You can change your Medicare supplement any time of year that you want. However, you have basically that initial, once you come off employer there, I think there's a 6-month window. You're guaranteed issue during that 6-month window. After that, you're no longer guaranteed issue. So if you have a Medicare supplement 2 or 3 years and now your premium's gotten high and you want to change plans or go to another carrier, at that time you will have to answer your what they call fully medically underwritten. So what that really means is you're going to have to answer a whole bunch of medical questions. They often look at your prescriptions, and then they can make a determination if they accept you, if they decline you. And then what we also see sometimes is if they have a published rate, they can rate above that published rate. They could come back and say, well, we'll accept you, but you'll have to pay 20% above the published rates. So most times you see accept or decline, some will do they'll rate increase you. So the Medicare supplements are always the tricky ones down the road. So when you elect to go on Medicare, you are kind of make a decision then what product may be available to you later. So it's much easier to have a Medicare supplement initially and then go to a Medicare Advantage plan because there's no medical questions asked at all to go into a Medicare Advantage plan. But if you have a Medicare Advantage plan for several years, now you want to go to a Medicare supplement, you would be fully underwritten and may not be able to get the Medicare supplement. So like I said, Medicare supplements always down the road could be tricky. All right, let me look kind of some of these questions. I've kind of covered what I knew I wanted to cover. Okay. What if retired and stay on the employer plan? I don't know. Are they eligible to stay on once they're retired on your employer plan? I mean, you would have to have retiree coverage, I guess, available. If you aren't working full time and there's no retiree coverage, then I would think you would have to go on to Medicare A, and you would have to go on to Medicare, as I think how I would answer that. And then I know.
Could I talk? Yes, we have an employee retirement plan. So I guess my question is, would I have to compare that to going on a supplemental or an advantage plan?
Yeah, so normally then what I do with that, I have quite a few that happens with, is you would want to look at what does it cost me to be on the retiree plan? What is my deductible and what is my maximum amount of pocket exposure by staying on the retiree plan versus going on to Medicare? Because you know you're going to have to pay that Part B to go on to Medicare, and then what your costs would be associated to go on to Medicare Part D. And like I say, often a big factor for that is what your costs are for your prescriptions. That can make a big difference. I know often on employer plans, the prescriptions go towards your medical maximum amount, that medical maximum out of pocket. So that can make a difference also. So you would want to evaluate and kind of cost out, what's it cost me to go stay on retiree versus going on to Medicare. For the Part B, since the first 2 years, based on full. Okay, so once you go on Medicare Part B, like you said, your Part B, what you're asked to pay for Medicare Part B is based on your income. They look back 2 years on that. And then what happens is down the road, obviously, often your income decreases. So I have been told by clients, Medicare or Social Security isn't real quick to drop your amount back. So if you initially, your income's higher and you're asked to pay more for Medicare Part B and D, then down the road, as your income decreases, you would want to go back to Social Security because, like I said, I don't think they're real quick to drop back. You would want to go back to them and say, reevaluate my income. It's lower now, and my Part B amounts should now be less. So, yeah, but they do look back to 2 years for that. So it can decrease down the road based on your income.
Great. There's also a question about the packet. We will be sending out these handouts to everyone that's on the call. Most of you should have gotten them before the presentation, but we'll make sure everyone gets those. So another question, Julie, for the Part B premiums, since the first 2 years after starting coverage are based on fully employed tax returns with a premium decrease as your income decreases. Oh, that's the one you just answered.
Yep, just answer that. Yep.
Can you
So can you change from an F to an N? You most times for most of the companies, if you want to change plans, even to go from what I would call an F to N, years ago when you could change from an F to an N because the benefits aren't as good. So the plan F would be really strong benefits. The plan N would be lesser benefits. You used to be able to go from an F to an N without medical underwriting. Most of the carriers now, whether you change, it doesn't matter what plan you change, they do require full underwriting to go from like an F to an N or an N to an F, either way, is what I'm finding now. It didn't used to be like that, but I'm finding pretty much any plan change, any carrier change, you are now fully underwritten in order to do that. So I think that answers that. The next question about injectable prescriptions. So if it falls on, it's always to your benefit if the injectable prescription falls under Medicare Part B. So normally when we're evaluating this, I would want you to ask wherever you're having it done, does this fall under Medicare Part B or Part D prescription? So anytime injectable is under Part B, it is mostly to your advantage because at least you either have a cap, or if you have Medicare and a supplement, they're going to pick up that 20% you would be responsible for. If it falls under prescription, then you're going to run through the good chance you'll end up in that catastrophic, relatively quickly. And then you're going to get hit for the first, month or so pretty hard and have to pay quite a bit out of your pocket, but then it'll be in the catastrophic amount and your responsibility would be 5% for that injectable type prescription then. So the key there is to find out if it's covered under Part D prescription or Part B medical. So I think that answers that. Supplemental, Medicare supplements are not based on income. Medicare supplement are based on zip code, age, and male, female is the main things that they're going to base it on, not on income. Income related, so in Pennsylvania or federally, Pennsylvania has the PACE program. Once you are 65, you would be eligible for PACE. That's the prescription plan in Pennsylvania. So if your income is lower, you would be eligible for PACE, and that gives you a lot of help with prescriptions. And then there's also what they call LIS, low income subsidy, and that's more federally based. And that is also assistance with prescriptions based on income. So that is available for lower income. They're also what they call dual eligible. So if you're eligible for Medicare and Medicaid, there are plans specific to that lower income bracket also.
Can I ask a follow-up to that?
Yes.
I was pricing supplemental plans and they were like $300 and $400. So way more than what you were saying at 135. So that's why I asked. I thought maybe my income was too high. So I'm not sure why they were so high. I was on, I think, the Medicare site.
I don't know. I don't know. It's usually based on zip code. I mean, 300 and some for a Medicare supplements really seems very high. A plan F, boy, I don't even see a plan F being that high. So I'm not sure what you were on. And I don't know if that was like a combo of, but Medicare, that's 300 and some dollars for a Medicare supplement is very high, especially at age 65. I don't know what your age is, but that is very high. We're more even high right now at age 65 would be in the $150 range for a Medicare supplement. So I'm not sure what that was.
Okay, yeah, I think I'm only 60 now, but I think I put age 65 in, so, okay.
Yeah, I'm not sure what that was. That's very high. So I don't know if
Okay.
the zip code was off, or in our area, that would be extremely high.
Okay,
Somebody commented about, so if you have a very high prescription, like that somebody asked about the injectionable, they're based on income too. You can also go direct to the pharmacy, whoever is not the manufacturer. And sometimes there's manufacturer plans that will assist with that high cost prescription. So that's an option also sometimes. If you choose a Medicare Advantage plan 1 year, can you go to traditional Medicare another year? Maybe. So if you have an Advantage plan, and you have that Advantage plan, if it's your first year in an Advantage plan, if you had been in a supplement, you went to an Advantage plan, you're not happy with it, you have a one-time chance to go back to a Medicare supplement. If you have an Advantage plan for 2 years and now you want a Medicare supplement, you can go to Medicare Supplement, which is traditional Medicare. You can go back to Medicare supplement, but you would be fully medically underwritten. You can just go back if you have an Advantage plan. Now you want just Medicare, you can go back to just Medicare, but you may not be eligible for Medicare and the supplement. Like I said, you can have just Medicare. You don't have to have any other products with it. So you would be eligible to go back just to Medicare, but you may not be able to purchase a Medicare supplement. If you choose a Medicare supplement plan to go with a certain company, for example, AARP, and then after a few years would like to change to an Aetna, can you do that, or does it need to be underwritten as well? It would indeed need to be underwritten to go from one carrier to another. They would fully underwrite. You would have to answer all the medical questions. Yep. Somebody has regular infusions that are discounted by his medical insurance before the copay is calculated. Does the Part B plan work the same way? Depending on the infusion, if it's, like I said, if it's covered by medical, the Medicare Part B side, if you have Medicare and a supplement, it's going to pick up that 20% that you would be responsible for. If you have a Medicare Advantage plan and have an infusion, it falls under Part B, and your responsibility for that infusion would be 20% of every infusion. In that case, I don't often make a recommendation to go one way or the other, but if you came in my door and told me that you were having infusions when you came in the door, I would probably highly recommend you consider a Medicare supplement, because it's going to pick up that 20%. You wouldn't be responsible for it, whereas in the Advantage plan, you would be responsible for it. I'm going to continue to work after 65 and not collect Social Security and have employer coverage. Can I wait to sign up for Medicare when I retire, or should I do it at 65? Most times you do not want to pick up Medicare and have employer coverage, because you have payroll deductions to be on the employer, and it's going to duplicate if you pick up Medicare. You're paying almost 2 premiums for the same thing. So it's normally, I would what you call defer your Medicare until you decide to retire or go part-time where your employer coverage isn't available. And then at that time, like I said, usually if you give yourself 3 months ahead, things will work out nicely. If you can, 3 months ahead of retiring, because it takes Medicare a good 2-3 weeks to process your, you're wanting to enroll in Part B. You would want to do research on your products, and you really would want to probably apply for those products you want to go along with your Medicare about a month and half ahead. That way, come your effective date, all your plans, policies, and cards will be in hand, and it'll be a little bit less stressful. So I usually would say if you can give yourself 3 months ahead before you, if you can, to sign up for Medicare, that would be great. And like I said, that's done through Social Security. So I think I hit all the questions.
Julie, if you decide not to take it on at 65 because you're continuing to work, do you need to do anything? Or can you
If you're
just
not
let it
taking
run?
Social Security, there is absolutely nothing you need to do. What will actually happen is when you actually enroll, let's say you decided to enroll when you're 70 into Medicare, you will find your Medicare Part A date will be the first of the month of your 65th birthday. And then your Part B will be effective 5 years later, whatever plan, date that you enroll in Part B. But your A will always be, no matter when you decide later, your A date will always be the first of the month of your 65th birthday.
All right.
So you technically, if you continue to work, you could ask for your Medicare card if you have Part A, and then that technically would be your secondary for your hospitalization. So you could use it as your secondary for your hospitalization if you wanted. But usually I don't recommend having your employer coverage and Part B. You're just paying money unnecessarily.
Terrific. Well, I think that you very well took a very difficult, complicated system and made it understandable. So we really
Hopefully, good. Hopefully.
Thank you.
Yep.
And please note